The Sharing of IPS profile is part of IHE's contribution to the IPS Cross-SDO Collaborative. I will cover a short introduction to the IPS, document sharing, and the variations supported. I am John Murky, co-chair of IHE IT Infrastructure Committee and employee of Bylight Consulting. What is the IPS? IPS stands for International Patient Summary. This is a cross-SDO collaboration where each SDO provides standards artifacts designed to be complementary and highlighting the strengths of each SDO. SEN and ISO provide specifications that define the data model and the IPS content. HL7 contributes 2 implementation guides designed to assist implementers with both FHIR documents and CDA documents. SNOMED International supplies a free IPS terminology set with accompanying hierarchical ontology, and IHE with the sIPS showing how easily IPS fits within existing document sharing infrastructures with conformance testing at IHE Connectathons, and we'll have some upcoming use case specific clarifications on the use of the IPS content. IPS is a standardized set of basic clinical data. It includes most important health care related facts such as medications, allergies, problems, immunizations, results, and procedures. A summarized version of a patient's clinical data provides health professionals the essential information needed for care. It's not an exhaustive extract of the patient's record. Although originally designed for cross-border unscheduled care, the IPS has also been implemented to support both scheduled and unscheduled care within a particular country, crossing other boundaries such as provinces, states, cities, and even organizations. Although designed to ensure global adoption across national borders, the IPS has been recognized as a powerful tool to support the care across any geographic or organizational boundary. IHE Document Sharing is a family of topology solutions, starting 20 years ago with Cross-Enterprise Document Sharing, XDS, and most recently, Mobile Health Document Sharing, MHDS, with MHDS being based completely on FHIR infrastructure. Key to document sharing is a defined metadata model that enables discovery, privacy, identity, document lifecycle, exchange methods, and provenance. Document sharing is specifically content agnostic, so any kind of document can be shared. Formal health documents like CDA have been the implementation focus so far, but the solution is not limited to CDA. Supporting FHIR documents requires no needed changes to document sharing at all. Other document types, such as DICOM documents, PDF, text, and images. Specifically, the document in document sharing is very unconstrained concept, not limited to formal documents like CDA, but includes all kinds of files. Within document sharing, there are relationships between document entries, transforms, signs, replaces, can be used to show lifecycle management of documents. Shown in the blue is an example where an EMR publishes an IPS and then publishes a set of transforms that are syntactically different formats but are the same semantic content. In this way, the linkage between the sub-transforms and the original is clear. There are also special kinds of document entries such as on-demand and delayed document assembly. More on on-demand later. This slide brings these two worlds together. On the far left, you have systems that are a source of an IPS document. On the far right, you have recipient systems that are consuming an IPS document. And in the middle is IHE's document sharing in its various topologies. At number 1 is the push models. There's a set of profiles available from IHE that support a FHIR-based push, a SOAP-based push, or an email push, or removable media such as a USB memory stick or DVDs. At number 2 is a query and retrieve model, orchestrated within a health information exchange, starting with things like XDS, but also support through MHDS. And then there is a federated model called XCA available for document consuming, where they can query multiple health information exchanges. Health information exchanges that might be XDS based, but might also be other implementations, such as an EMR itself. And then at number 3 is this model I spoke of on the previous slide with on-demand. On-demand is a special kind of an entry where a source system publishes that they are able to make an IPS on demand. And in this way, the recipient systems can find these entries and know that if they request that entry, they will get a freshly made IPS. So when they request that, the request goes to the source system, where some software assembles an IPS based on policies, based on current patient information, and produces an IPS freshly made. The details of the sIPS profile are rather simple. Content creators must create IPS documents that are conformant to the HL7 FHIR IPS implementation guide. We do define a format code that identifies that the content creator followed the IPS specification, and content creators and content consumers must be grouped with one of the IHE document sharing transports or more, and through their integration statement, it would be made known which of those transports they can communicate the IPS over. And then lastly, content consumers must have some kind of use of the content. It might be just simply viewing it, it might be importing it, or other. The IHE Connectathon are a set of events put on around the globe each year by IHE. With the IHE Connectathon, we produce a test plan and test tools for each of the profiles that we have published. With the sIPS, we'll start off testing that the content that is created is conformant to the IPS. And we'll use the HL7 and MITRE test validation tools. Testing the document sharing is something that we've been doing for many years, using the IHE Gazelle and NIST test tools. And then 3, we'll be testing that IPS can be communicated over those transports that are declared, meaning it can be queried for, retrieved, published, or pushed. We do expect that there will be some other higher level use cases, such as transfers of cares, EMS support, maternal health, that will use the IPS that may also be tested at a Connectathon or a Projectathon. And then we also expect that there will be regional specializations from regions such as Canada, USA, Netherlands, and Switzerland. This was just a short introduction to the sIPS. The profile can be found at the first link on the page. The second link is where you can find far more information about the International Patient Summary. And the third link has details around what is document sharing in its various forms. I'm sure I haven't answered all your questions, so I will offer up that you can ask questions to me via my email address. Thank you.